So, at the beginning of our conference, I shared some information with you that I hope set the stage, some really basic information about electromagnetic fields and how they can interact with health. And we talked a little bit about biomarkers, these early signs of biological interaction like oxidative stress and the DNA damage studies. And we also touched on chronic health effects, and Professor Davis has talked more about the cancer studies, where we have seen that human epidemiological data showing increased tumor types, especially schwannoma and glioma, has been corroborated and reinforced by some of the largest animal studies ever done to date, the National Toxicology Program data and the Ramazzini Institute data, which, by the way, was looking at far-field radiation. So we now have the same tumor types seen in human epidemiological data from the highest long-term users, and studies of cell phone radiation on rats and mice, and again on far-field radiation emulated from base station type exposures. So really it becomes highly illogical to try to refuse to accept that kind of concordant evidence all working together. So from biological issues and chronic issues, in the middle, it is not surprising that we are seeing some groups of people who have acute, that means short-term symptoms. That is actually exactly what we would expect. And this is termed at the moment most commonly in the scientific literature electromagnetic hypersensitivity, or EHS. What is this? Well, if I had to sum it up in one sentence, I would say acute symptoms attributed to non-ionizing radiation exposures. And that could be the low-frequency fields you get with your household wiring and overhead power cables, or it can be the high-frequency fields from your mobile wireless devices. And the most common symptoms are headache and sleep disturbance, are two of the most common. Also dizziness, tinnitus, palpitations, rashes, sometimes a very objective sign. And interestingly, chemical sensitivity and food sensitivity. This is really important when we're looking at our young childhood populations where we're seeing these issues rising. And so many people are asking, why is everyone becoming allergic and sensitive to everything? And we see this interaction where it's proposed that we have a united mechanism possibly joining these two together, that one can fuel the other and vice versa. Now, this issue is often marginalized and sort of brushed under the table, where people are a bit uncomfortable. They say, well, maybe it's all psychological, maybe it's not, but it's hardly anyone. And that just isn't true. Unfortunately, this is a growing number of people. In 2019, the European Economic and Social Committee, the EESC, estimated between 3 and 5% of the European population affected. And actually, some studies from individual European countries more recently have shown figures up to 10% or even higher in some cases. In England, in Britain, that would translate to up to potentially 7 million people. So this is something that we can't simply bury our heads in the ground about. Now, you might look to the WHO when you're trying to understand this and get information. And there's unfortunately a lot of very outdated information there. This on their landing pages from 2005. But let's enlarge this, because I do agree with everything that's written here. They point out the classic central nervous system symptoms that I've already mentioned. And then they say whatever its cause, EHS is a real and sometimes disabling problem for the affected persons. Their EMF exposure is often several orders of magnitude under the internationally accepted standards. All quite true, but why do they raise this question mark about causality? Now, causality is complex in medicine and science, and we go through a number of steps to try and determine causality, but we start with the plausibility test. So, would we expect, from a common sense point of view, that these kinds of fields could cause those kinds of symptoms? Now, we don't have to look laterally very far in the literature base to see that we have studies showing, for example, cardiovascular disturbance from in certain human subpopulations, sensitive subpopulations, from things like solar flare activity or geomagnetic storm activity. Many reports of people who have headaches with fluorescent lighting, etc. So that gives us a hint, well, yeah, this actually does seem quite reasonable that these anthropogenic man-made fields could also be disrupting our physiology. And I mentioned to you at the beginning some of this, the fact that we're electromagnetic in our very essence. That also tells us, you know, we shouldn't be sidelining these reports. Actually, it makes a lot of sense. And when you look at the fact that UVA and UVB are both listed currently as carcinogens, and these are non-ionizing radiation fields. There are so many different layers of evidence, and let's think about the fact we have magnetite and cryptochromes like animal species that are deliberately designed to interact with our electromagnetic environment. So much in terms of plausibility and common sense to make us extremely suspicious that this could cause health effects. However, the reason the WHO asked this question, what is the cause? Is it really EMF? Is because groups like the guideline setting group, ICNRP, have suggested this is a psychological reaction, that it's all in the head, that it's something they refer to as the nocebo response, which would be physical symptoms from a negative expectation. Now, I would suggest in such a large number of people reporting the same constellations of symptoms, which, by the way, are not classic of a phobia reaction at all. They're quite a specific constellation all over the world. I'd say it's not actually very plausible that their new best friend, their mobile phone, is upsetting them so much they're getting a headache. But let's look more scientifically, because the only Bradford Hill causality criterion that is essential is temporality. What I'm saying there is if A is going to cause B, A obviously has to precede B. And we have a problem here because, in fact, most of this group had no concerns at all about the technology they were using before they got their symptoms. In fact, many of them were completely unaware that it was possible to have symptoms from their device exposures. And this was noted in this questionnaire study. So those who claim EHS is not caused by EMF rely really on two basic principles. One, they say low-intensity effects are not possible. We talked about that at the beginning. And then they look at the outcome of what we call EMF provocation studies. I'm going to briefly look at these two in turn. So firstly, number one, can we have low-intensity effects below these thresholds? I think my first talk and Professor Davis's talk have both been clear that there are many, many papers demonstrating a huge myriad of different biological effects. But just to recap, oxidative stress, in our recent paper here, we showed over 100 papers, 95% of which showed effect. And let's translate this up to a relevant system, the neurological system, which we know is heavily impacted. This, thank you to Henry-Blythe and colleagues at Bioinitiative Report, a very highly qualified group. They've got 3 former presidents of the Bioelectromagnetic Society. And Henry-Blythe found in this study 244 out of 336 papers showing neurological effects from these kinds of exposures. And these studies are not limited to people with EHS. Some of these studies are involving animal groups. Now, we know animals are not reading newspapers and scaring themselves about their mobile phones. So really, we have to take number one off the table. All of those papers cited were below the allowable guidance levels at low intensity. So we need to release this outdated dogma that there's no such thing as low intensity effects. In fact, what we have failed to do is find a no effect threshold. The doctors and scientists know what I mean by this. We have not found a no effect threshold in this literature base. Let's look at number 2, EMF provocation studies. What are these? Well, these were an attempt to look at the relationship between EMF exposure and symptom development in the setting of a laboratory under scientific conditions. Now, that sounds like a great idea in essence, and in certain ways it is, but you have to understand EHS and any other condition very well to be able to structure a study like this correctly. And unfortunately, people rushed into these studies and they clearly did not understand EHS, because they made a huge number of errors. And in fact, almost all the literature in this relatively small study pool is fatally flawed for a long list of reasons. And they're basics like not looking at the timing of the reaction. This is not a time-locked response like seeing a light go on. It's not like that. And many of you will understand this entirely. Think of dairy sensitivity or gluten sensitivity. If a mother brought in her child and said, I think my child may have gluten intolerance, and the GP said, here, eat a piece of bread and then watch the child. And 15 minutes later says, how do you feel? And the child says, I feel okay. He says, right, you're not gluten sensitive. And then does that with a few more children and goes, there's no such thing as gluten sensitivity. That's what's actually happened with this literature base. And there's such a myriad of problems with these studies. It's, it would take me an entire lecture to describe them. But the other problem with these is their sham condition, in many cases, not really a sham. So if you're going to look for effect, then you have to look when the substance is present and when it's truly not. Like, you can't give somebody a big loaf of bread and then a little bit of bread and have the little bit of bread be the sham condition. But that's kind of what they've done. In the sham, they often had anthropogenic or man-made radiation actually present. And we know that the way hypersensitivity works is that infinitesimally small levels of the substance can set up a reaction. So these studies are shambolic at best. And the problem is that then these appalling studies have been collated together, and people have tried to do a systematic review of them, and they've made exactly the same errors again. They've failed to recognize the correct study design. They've failed to understand the clinical characteristics of EHS and therefore put together the correct risk of bias tools. This is again for our scientists in the audience. And therefore they have missed the fatal flaws in these studies and inappropriately tried meta-analysis. And this study group is also extremely heterogeneous. So that's provocation studies, but they've also done a systematic review looking at the longer-term EHS-type symptoms. And ICBE have put out a publication calling for a retraction of this systematic review already, even though this literature is only just published, because they've pointed out the body of evidence is not adequate to support or refute the safety limit. The small number and low methodological quality of those primary studies they looked at was inadequate, and there was inappropriate meta-analysis once again in this group as well, given the heterogeneity of the studies. So that's for the scientific group, and if people want to understand that more at the end, I'll explain a bit more in the question time. So just to recap, there are major, major problems with this hypothesis that this is all in the head, the nocebo explanation. Firstly, most people had no concerns about their phone before they got symptoms. Fear is not a cause in that situation. Many of this group, in fact, were technophiles. They desperately tried to keep using their technology because they were dependent on it for their job or for their enjoyment of life. It doesn't fit with their fear response at all. And even though these studies were terribly put together from a methodological point of view, some of these double-blinded provocation studies actually did show a reaction. And that completely excludes psychological causes in that group. Then we have the animal and plant studies that I mentioned, and obviously psychology isn't possible in that group. And biological effects proven that could be valid mechanisms explaining some of these symptoms. So we have to take both of these off the table, and we don't have any scientifically valid way to invalidate the testimonies of this growing group of people claiming hypersensitivity and acute symptoms. And therefore I want to thank groups like the Europa EMF 2016 guideline group who've just got on with it and put together guidelines for diagnosis, management and support of people with EMF illness, including but not limited to EHS. Now, ICNIP set the guidelines admit themselves in 2020 here that it's not always easy to draw a clear distinction between biological effects and health effects, and this will vary from individual to individual. Absolutely right. What we know is that, in fact, it's a grey spectrum, as I pointed out at the beginning. And so the biological disturbance that we have is actually crucial. That is where we have the ability to enact preventative healthcare, something we're supposed to be all about here in the UK. That is what you have to pay most attention to, because that is the only place you have a chance of preventing acute illness and the subsequent chronic illness, which will transpire if you don't. Unfortunately, exactly the opposite is what's happened in reality. And they've tried to draw a line, the guideline setting group, they've drawn a line between biological damage and health damage. They've tried to put them in two baskets. Now, that doesn't make sense medically, you can't really do that. But I understand if you're trying to set a safety threshold with something where you've actually never found a no effect level, then you are drawing an arbitrary line. But if you were forced to do that, I would say you definitely wouldn't want to do it here, because they are classifying things like tingling sensations, light flickering, microwave hearing, and pointing out that these perceptions, as they're calling them, can lead to discomfort and annoyance, and the exposure circumstances will vary between individuals as to where their threshold is in developing them. The problem is that in reality, medically, symptoms like this can signify substantial biological disruption, and people with EHS are absolutely not experiencing merely discomfort. Some of them are experiencing severe pain and broad-ranging disabling symptoms, as noted by the WHO way back in 2005. So it's no surprise really that we're seeing international legal actions won by people with EHS, in some cases mandating a low EMF environment. Now, when we're talking about sensitivity and increased sensitivity, it would be wrong for us to be so insular as to only look within the human population. Never has the wildlife around us been more important than it is right now. And all of these species have very clear dependence on their electromagnetic environment, sometimes for survival and certainly to flourish. So these aquatic species, these aviators, and these land-dwelling mammals, including us, all have these specialized cells that we've identified and substances we've identified, and some of these are really hypersensitive groups. We might raise this a bit more in question time, because this does pertain, there's a slightly different biological spectrum of activity with the higher frequency uses in 5G that may be particularly prejudicial to pollinators, etc., because of their body size and the wavelength used. But to find more, there's a 3-part series looking at effects on flora and fauna that you may be interested in reading. Now, very quickly to wrap up, I'm going to move on to, I realise we've shared a lot of science today, and not everybody in the audience has a scientific background. I'm just going to mention some sort of collateral evidence that can help you in, because it's really hard. You've got one group of scientists saying everything's fine, there's nothing to see here, and another group saying this is really not fine. And how are you supposed to make a judgment in there? I think it's really difficult when you can't necessarily get to grips with the fundamental science. So in terms of further evidence, some people have done some important work. So this has happened partly in courts. There are courts that have ruled that brain tumours have been caused by the mobile phone, and people compensated for that. I should mention glioma is a fairly rapidly fatal tumour. The 5-year survival is very, very low. Compensation cases are not what we want to be seeing. We want preventative healthcare for this. Then Professor Davis already mentioned this, that some companies are warning their shareholders. And there's a major problem with insurance, because insurance companies, I'm not personally aware of any underwriters currently who will insure for RF-related health effects. And this is just a report from Swiss Re rating 5G as a high-impact risk affecting property and casualty claims, especially after 3 years of deployment. So we now have legal firms stepping up and saying that they're willing to take on no-win, no-fee Wi-Fi injury cases. And bringing this down to a really humble level, there's been a lot to take in, I know that. But I find this interesting. I put this slide together many years ago, and I thought to myself, you know, parents have to sign a consent form if their child steps out of school really to do almost anything. And there's a risk assessment that takes place when that happens. Now, when anything changes in a school environment that could possibly pose a threat to child's health, there is supposed to be a risk assessment. But this has not been happening. If it were, people would be a lot better educated about the science, actually. But we all risk assess as well. So we've got some doctors in the audience, we have to do consent forms, and the consent has to be informed, doesn't it? We can't just say, oh, everything's fine, sign here. You have to have a full understanding of the literature base. Now, if you were having to sign a consent form for Wi-Fi, I worry that you would have all of this on it. We're going to irradiate your child with a group 2B possible human carcinogen. Exposed to radiation shown to cause DNA damage and other biological disruption, such as, and really there's very multi-systemic effects of this. I'd feel very uncomfortable about that. But this discussion is not currently taking place, and parents and schools remain extremely unaware of the science. Now, I talked about risk-benefit assessment, and that is what this is all about. We all do take risks. You know, we put our child in a car every day, quite often, and we know we're taking a risk when we do that, but we calculate that the benefit is worth it. here, when we do this risk-benefit calculation, I am struggling to find where we can offset, even if you determine that you think this risk is very low. One thing nobody can say there is no risk. Even the WHO have this currently listed as a possible carcinogen. Nobody can say this is all fine, there's no risk. That's ludicrous at this point. But where is our benefit to offset that risk? And the fact is, it's just not there, because we can provide internet to children through hardwired connections. And this is what the last part of our conference is going to be all about, is easy, accessible solutions that schools can use. So we don't need to be taking these risks. It's that simple. And I'm not personally fond of a half measure either. So people will say, well, we'll turn the routers off when we're not using them, or we'll move them away. But really, that kind of attitude is often about convenience for staff. Everything can be done generally with hardwired connections. And if we look at half measures, I think it's very akin to this advertisement that was put out by Cancer Research UK many years ago, pointing out, unfortunately, when it comes to low-tar cigarettes, there's no such thing as cancer extra mild. That's not really how it works. So, in a nutshell, what do we need to do? Remove, replace, and reduce. And I'm going to round up here with the EESC again, because they wrote a really nice piece of literature about EHS. And they pointed out the importance of reinforcing independence of bodies setting limits, binding safeguarding legislation to reduce electromagnetic radiation exposures, and recognizing these exposures as a cause of functional disability and environmental illness. Because we now have a crisis. We have children who can no longer safely go to school, adults who can't access their workplace, and in both cases, people who actually can no longer access their own home because of penetration of radiation through the walls of their building, let alone a hospital bed. So we have people who have life-threatening illness who cannot be seen by a medical professional. So the group that I work with, International Commission on Biological Effects of Electromagnetic Fields, has put together this statement pointing out this is now a humanitarian crisis that requires an urgent response. And please don't think that we're alone. I think it's very easy when we get on with our daily lives to miss what's happening scientifically on this front. But there are appeals from all over the world, from scientists and doctors who are specialists in this field, experts. The EMF scientists' appeal can only be signed by people who've published papers in this field, and they have well over 100 signatories, but I think a lot more than that now. And here in the UK, this was put together by my group, FIRE. This is still open for signing. So both scientists, doctors, and anyone else who wants to sign this can. And the American Academy of Pediatrics have pointed out some really important points about hardwiring. This is from the Cyprus Medical Association, who got very strong wording, actually. And all these resources, don't try and read these, but we will make them available to you. Some of these are on the FIRE website, pointing out carcinogenicity, neurotoxicity, EHS, and pointing out how low these effects can occur, and that in some cases it appears some of these effects are irreversible. So in summary, non-thermal, or better called low-intensity effects, can induce biological damage. Present exposure limits must be urgently revised. Children are especially vulnerable. Hardwired connectivity can immediately protect children, and low EMR areas to protect vulnerable groups in general, both adults and children, and frankly, anyone who does not wish to be exposed, because that's very important. At its very heart, this is a consent issue. And anyone who does not wish to be exposed should be able to avoid that exposure. Thank you so much.